What triggers focal seizures in epilepsy? Imagine a tiny spark in the brain that suddenly ignites a wave of electrical activity in just one area. That's what a focal seizure is. It starts in a specific part of the brain and can cause different symptoms depending on where it begins. Now, while epilepsy is a long-term condition that makes seizures more likely, certain things can set off these episodes. These triggers do not cause epilepsy but can make a seizure more likely to happen in someone who already has it. One of the most common triggers is lack of sleep or sleep deprivation. When you don't get enough rest, your brain becomes more sensitive, lowering the seizure threshold. This means seizures are more likely to occur. Stress and anxiety are also significant triggers. Emotional pressure or major life changes can activate the brain's electrical instability in some people. Missing doses of anti-seizure medication is another major factor. Consistently taking medication as prescribed helps control seizures, and skipping doses can lead to breakthrough seizures. Alcohol consumption can trigger seizures, especially if you drink heavily or experience withdrawal after stopping alcohol suddenly. Illnesses like colds, flu, or fever can also increase seizure risk, often because they cause dehydration or disrupt sleep. Dehydration itself is a trigger, especially during illness or physical activity when fluids are lost. Low blood sugar from skipping meals or fasting can also set off seizures in some individuals. Electrolyte imbalances, such as abnormal sodium or calcium levels, interfere with nerve signals in the brain and can trigger seizures. For some people, flashing lights or visual patterns can cause seizures, a condition known as photosensitivity. Hormonal changes, like those during menstrual cycles, can make seizures more frequent. Certain medications, including some over-the-counter drugs or antibiotics, may lower the seizure threshold. Recreational drugs like cocaine or ecstasy are known triggers, as is excessive caffeine, especially if it disrupts sleep or causes jitteriness. In rare cases, specific activities like reading, eating, or even bathing can trigger reflex seizures. It's important to remember that triggers vary from person to person. Some may have no identifiable triggers at all. Keeping a seizure diary can help spot patterns and personal triggers. In terms of safety, managing these triggers involves maintaining regular sleep schedules, reducing stress, taking medications consistently, staying well hydrated, and eating balanced meals. Avoiding excessive alcohol, recreational drugs, and known personal triggers can also help reduce seizure risk. If you see someone having a focal seizure, stay calm and keep them safe. Clear the area of sharp or hard objects and gently guide them away from danger. Most focal seizures are brief and don't need emergency help unless they last longer than usual, happen repeatedly, or cause injury. Always seek medical advice for personalized management strategies. Remember, understanding your triggers and working with your healthcare provider can make a big difference in controlling seizures and staying safe.